The next lesion I'm going to show you again owes its phenotype to abnormal connections between the segments. So let's analyze the heart sequentially. Here is a coarse triangular appendage, suggestive of a right atrial appendage, but we know that the phenotypic features of the right atrial appendage are pectinate muscles extending around the atrioventricular junctions. And here we see those pectinate muscles extending to the crux and the coronary sinus. In this heart, the morphologically right atrium is opening through a tricuspid valve, and the right-sided ventricle is coarsely trabeculated, concordant atrioventricular connections. But arising from the right ventricle is an arterial trunk which gives rise to brachiocephalic vessels and also gives rise to the coronary arteries and aorta. So the ventriculo-arterial connection is discordant. And when we turn to the other half of the heart, we see the counterpart of concordant atrioventricular connections, with the morphologically left atrium passing through a mitral valve to a fine crisscrossing apically trabeculated ventricle, the morphologically left ventricle, and then arising from the morphologically left ventricle a bifurcating arterial trunk, the pulmonary trunk. Note that because this is a left ventricle, there is fibrous continuity between the arterial and atrioventricular valves, whilst in the right ventricle a complete muscular infundibulum supports the leaflets of the aortic valve. This combination, concordant atrioventricular and discordant ventriculo-arterial connections, is usually called simply transposition or complete transposition.